Tamale Murunde is taking his morning dose of oral morphine in Uganda's capital, Kampala. It wasn't until 2004 when patients like him were able to access a narcotic drug for pain relief administered at home. The 26-year-old has soft tissue sarcoma, a rare but aggressive form of cancer that develops from certain tissues in the body, like bones and muscle. He is receiving home-based care from Hospice Africa Uganda, an organization which specializes in health care for patients in severe pain.
Before I started taking morphine solution, I used to be in too much pain. When I started taking the morphine solution, I could even sleep. Before that, I could stay awake the whole night. But with morphine, within 3 hours, I get to sleep well.
The liquid morphine is made by Hospice Africa using morphine powder bought from the UK and other countries. Uganda's government also makes and distributes morphine for supply to various hospitals. Morphine is an essential and inexpensive medication for treatment of severe pain. But unnecessary restrictive government regulations and poor training for healthcare workers impede effective medical treatment in many African countries. Some doctors also fear that prescribing it to patients can easily get them addicted, or that it can be diverted to produce heroin. The result is a reality for many in Africa. A cancer diagnosis often means a painful and distressing death.
Morphine is classified as a step 3 painkiller. It is a strong painkiller. It is a different class of painkiller which is able to control properly and appropriately the severe pain that is chronic, that comes from cancer and other palliative care illnesses.
While many cancers are linked to lifestyle factors such as unhealthy diets and smoking, a large number, particularly in Africa, are caused by infections like hepatitis B and C, which cause liver cancer, and the human papillomavirus, HPV, that causes almost all cervical cancers. Pain under treatment is estimated to affect half of cancer patients globally, according to a recent report in the Journal of Clinical Oncology. By 2030, according to predictions from the World Health Organization (WHO), 70% of the world's cancer burden will be in poor countries. More than 6.5 billion people are estimated to die each year without any access to pain medicines, almost all in low and middle-income countries. Human Rights Watch research in countries like Kenya and Senegal has found that for many patients, the suffering is so severe that they become suicidal or attempt suicide. In January, the WHO adopted a resolution urging countries to ensure access to pain medicines and palliative care for people with life-threatening illnesses. At the Uganda's Mulago Hospital Cancer Institute, 500 milliliters of oral morphine cost about $0.25. Patients admitted at a hospital's cancer ward now have access to morphine. In wealthy countries, having cancer prevention measures like hepatitis vaccines are part of routine childhood immunization programs, and introducing national campaign programs with new HPV vaccines from drug makers Merck and GlaxoSmithKline has brought rates of liver and cervical cancer down significantly. If such nationwide HPV vaccine campaigns could be introduced in Africa, experts say the effect on rates of death and disease could be dramatic. Global health groups are working with drug makers on securing a discounted price for HPV shots for poor countries, but getting them to Africa could take years.